Give you, Senator, a chance to respond to that. Your Waterloo statement that if you can stop President Obama on health care, it could be his undoing. And this idea that does that just give the perception that all you're interested in is scuttling this bill as opposed to trying to find health care reform?
Republicans are trying to stop a government takeover of health care. We've been working on reform for a long time. I've introduced a lot of ideas as a former small businessman myself. If we just do a couple of things, John, if we have tax fairness for people who don't get their health insurance at work, we could give every family in America $5,000 a year to buy their health insurance. And if we only allowed interstate competition between insurance companies, the cost of insurance would go down and the quality of the insurance products would go up. But the Democrats are fighting any real health care reform. They're insistent on a single-payer government takeover. The president has said it, Charlie Rangel, Barney Frank, all the Democrat leaders seem to be on record wanting a government-run health care system in America. And to pay for it, they're going to cut Medicare and crowd out private policies through employers.
Now, when you say, Senator, that they want a government-run health care program, I mean, they only want that as part of an overall health care program according to all of the bills that have been written. Now, you're not saying that they want to get rid of all the private plans and just have a single-payer government-run system, are you?
Yes, I am, and the president has said that. There's a tape on YouTube of his quote saying that we will replace employer plans. And
but where is that in any of the legislation that's currently making its way through Congress?
Well, you don't have to put it in legislation. If you have a taxpayer-subsidized government plan, it's going to crowd out the private policies in a very short period of time. They're already shifting so many costs from Medicare and Medicaid to private insurance. They cost about a third more than they should.
Yet the bill that has been agreed on in the House specifically states that the government would not negotiate at Medicare rates. It would negotiate at rates comparable to private plans.
Well, they would still be deciding what doctors get paid. And a taxpayer-subsidized plan is going to run the private policies out of business. The Lewin Group and other outside analysts say from 80 to 100 million Americans will lose their employer-based insurance, and more doctors are likely
under certain circumstances, and those circumstances are if the plan is open to everyone and they reimburse at Medicare rates, and that's not in any of the plans.
Well, you can't have a government plan at the state level for competition without running private policies out of business because it's subsidized. But we don't need to do that, John. All we need to do is allow interstate competition. Why do we need to create Fannie Meds in every state when all we need to do is open up interstate competition and create a national market for insurance companies? We can keep them more accountable that way and bring down the price. We don't need a cash for clunkers type of Medicare program running the healthcare business. They're saying it's going to cost $1 trillion, but we saw what happened with the cash for clunkers program. They ran out of money in a week.
Yeah.